Hello, everyone. My name is Chelsea Cirruzzo, and I'm a health reporter here at Politico. I also co-write our morning health policy newsletter. Del, I am very pleased to welcome you to the stage. Del Bigtree is the CEO of the Make America Healthy Again Action. He also was previously the comms director for Robert F. Kennedy Jr.'s presidential campaign. Thanks so much for being here.
Thanks for having me.
So the MAHA PAC really aligns with now Secretary Kennedy's vision for HHS. And seeing as you've worked closely with him, what is your relationship now that he's been confirmed?
Well, you know, he's, as I call it, he's inside of the submarine of government. I decided to not go into government with him. You know, when we spoke, we speak on occasion, but he said, look, I have to go in and try and deal with all the regulations around these issues. I need to be radically transparent. We're going to try and get studies done, but President Trump has given me 2 years to prove that I can reverse the chronic disease epidemic. And he said, go out, you know, work with this movement, MAHA, and, you know, deliver on that promise to make America healthy again. So I'm focused on working with all the MAHA moms. We're working on, you know, looking at the food pyramid and redefining it so that Captain Crunch isn't rated above, you know, a steak and things that we see there. And then really start working on, we're looking at school lunch programs and things like that. How do we get whole foods into children's lives, things like that.
Has anyone else from the movement moved into more advisory roles at HHS?
I mean, not that I know of. I mean, of course, we're still looking to see what the Make America Healthy Again Commission ends up being. We know that it's going to be a lot of the heads of the health departments, but I do believe there's going to be outside people brought in different specialties. So I imagine, you know, I know Callie Means is in conversation and people like that to bring, you know, thoughts around food, you know, the seed oils, the things that he's been covering, and also how Medicare and Medicaid recipients maybe can change the way that their health programs are working. So I think you'll see people moving into that position.
Mm-hmm. What do you want Secretary Kennedy to do in his first few days at HHS? And what are those conversations right now about first steps?
Well, I mean, look, I think his speech that he just gave to HHS, to the employees there, is exactly what we wanted to see. We wanted to see him talking about radical transparency, that everything is going to be on the table. I think that, you know, from his perspective, from my perspective, the reason that we were working together is, you know, in the investigations I've done with my nonprofit Informed Consent Action Network, you've got far too many controls from the corporations. You have big ag, big food, big pharma, all intertwined with our regulatory agencies, and it appears to us that many of the issues that should be being studied as far as America's health, I mean, we have, as everyone now knows, the stats are staggering. 60% of adults have a chronic illness, meaning they either have a neurological or an autoimmune disease. You know, 40% of our children are on the verge or are diabetic. We have the worst health stats in the modern world. And, you know, when you look at what's causing that, they have to be environmental factors. And people will say, you know, how do you know, is it the vaccines, or is it the fluoride in our water, or is it the pesticides that are being sprayed on our crops, or is it the hormones and injections in the meat supply that we're eating? Well, what I would say is every one of those things was approved by the same regulatory agency. So whatever it is, or the combination of those things, our regulatory agencies, for some reason, have been approving these poisons, which we're seeing in Europe and other countries. Many of these things are illegal. So finally, we have someone at the head of HHS that isn't owned by any of these companies, isn't owned by these corporations, saying, hey, I'm not going to choose sides here. We're putting it all on the table, and we're going to study all of it. And I think that that is going to provide results that could have happened, you know, over a decade ago or before. Finally, we're going to find out what is causing this health crisis.
We're going to get back to the corporate interests in just a second, but I do want to stay on chronic diseases. In the past few days, we've seen mass firings at health agencies spanning the FDA, CDC, NIH, all part of the DOGE agenda to cut spending. And those roles include people who work in the public health space. So how do those cuts align with the MAHA agenda to eradicate chronic diseases?
I don't really know. I mean, I'm not watching each person that's being cut. I'm not even sure that those cuts are being driven by Robert Kennedy Jr. I mean, he just got the job a few days ago. So those cuts are being, you know, driven, I think, by for financial reasons, and maybe they don't want to show up in their offices. I'm watching the same news that you are. But in the end, I know that what Robert Kennedy Jr. wants is he wants to have people that are passionate about doing real science, passionate about challenging the status quo, and are going to get away from dogma around, products or things that you maybe didn't want to go near. How are we going to figure out the issues that are going on if there's certain sectors of, environmental toxins, if you will, or products? If there's some that just are never allowed in the room, never allowed to be looked at, then you can't do that work. And I think that he's going to look at the people that are working for him. I mean, not all 80,000, but certainly the ones that are running those different departments, and say, what's your track record? Have you been taken? Have you worked for the pharmaceutical industry? Have you worked for big ag or big food? Have we ever seen you challenge, whatever those corporate interests are? I think he's looking for the right type of people. And America deserves to have people that are unbiased, doing unbiased science, not afraid to, really the scientific method. The scientific method demands that you actually, whatever hypothesis or whatever product, that you come in challenging it. A true safety trial, which, FDA right now, CDC, it's all done by people that believe that vaccines are the greatest thing in the world, that believe this drug is the greatest thing in the world, that believe these chemicals are safe. That's not going to deliver real science. Real science as a true safety trial is, let me see if I can prove it's dangerous. Let me hit it with everything I can. If I cannot prove this product is dangerous, then it's safe. Not studies that set out to prove it's safe right from the get-go. And I think that is the shift when he talks about getting back to, real science and getting back to, the ability to have, reproducible science. It has to be reproduced by people that believe in the product or not. You should be able to challenge it in any way. Instead, we only allow science that believes, has a faith in whatever they're looking at.
But do you think those agencies can get that work done with smaller workforces?
Absolutely. When we were looking at, as Bobby was moving in and starting to work with President Trump, and we looked at what are you up against? He's got 80,000 employees. I can't imagine what 80,000 employees are needed for when it comes to health. There's things like when you see Indian Health, which is the Native American Health Department, something like $8.4 billion per year. I remember when I saw that. My last name is Bigtree. My mother is Mohawk. I have been to reservations all over this country. These are the sick. They are known to be the sickest people in our country, in the sickest nation in the world. And I'm like, you look at it and say, $8.5 billion. Why doesn't someone put a grocery store inside of these reservations? I mean, how much is that going to cost? Get these people out of a food desert. That's where they're living. They're living out of 7-Elevens and gas stations as their groceries. There's just common sense that I think we're watching Doge right now. I think health is going to go through the same thing. What are we spending money on? Probably a lot of employees that aren't doing anything for the health of this country.
To go back to removing corporate interests in food and medicine regulation, which is what the MAHA movement has really pushed on, what does that look like in practice? Does it look like going to employees and investigating their backgrounds, as you had just suggested? You
mean going through in the regulatory agencies? Is that what you're asking? Yeah, I think it's like taking over any company. I think Robert Kennedy Jr. has to sit down with a team and bring in, people and say, show us what you've done. What have you done over the last 4 years? What have been your projects? What were your results? How efficient are you delivering on the goals? What were the goals you were set out with? And I think you have to see how productive people are. And if they're not producing real results and doing good science, then maybe there's a better job for you somewhere else.
Are there other ways you think Kennedy can eliminate corporate influence over HHS decisions, including at the FDA?
I think he's got to find a core team that he trusts that moves through the agencies. I think he's picking beautiful, powerful, great doctors in Dr. Mehmet Oz to run CMS. I mean, I've had conversations with Dr. Oz. I mean, he has a thorough understanding, a brilliant understanding of the issues around CMS, the third-party payers that are driving up the cost. So when you get people like that, Dr. Oz is going to build a brilliant team. Dr. Marty Makary, I think, would be fantastic at FDA. Again, he's going to build a great team around him. Dave Weldon at the CDC. I mean, these are people that we've watched that also, are great at speaking to the public. So I think when you're looking for radical transparency, you need doctors and scientists that actually know how to converse with the public. I mean, you have that in Dr. Macri and Dr. Oz, which I think is going to be really important, because this radical transparency, a lot of what I know the country is about to see, because I've done these investigations, I've been one of the ones saying, as Dr. Redfield just pointed out, we don't have proper safety trials on the vaccine program. That's just a fact. I've watched many of the writers say, oh, the experts say we have. The truth is that we could not find. There is not a double-blind placebo trial prior to licensure of a single one of the childhood vaccines. Now, when articles are written and the public reads, well, the experts say they have been done, well, now we're going to say, here are the trials. Here's what we have, here's what we don't have. What does the public do then when they see that? You need people that can explain that and say, now here's how we're going to fix this issue. So I think it's going to be about that public and private, so the government working with the people, of, for, and by the people, that's what's going to transform the health department.
Well, let's talk about, you mentioned the childhood vaccine studies.
Yeah.
And last week, you spoke at a press conference that HHS should do another study on the link between vaccines and autism. But there have been a number of studies investigating that link. There was a 1991 one by Brent Taylor, another on children in Denmark in the 90s by Dr. Christine Madsen, and dozens of others that have disproven that link. What would this study that you're proposing do differently then?
Oh, well, first of all those people set out to disprove the link, and that's my point. What happens if you try to prove the link? That's how real science is done. If the entire statement is that vaccines don't cause autism, finding scientists that set out to prove that vaccines don't cause autism, that's not how you do that study. Get scientists say, I think I can prove vaccines do cause autism. And if they can't pull that off, now you have a true safety profile. So we've been, doing science the wrong way. I think very simply, you could start with a study of the VSD, the Vaccine Safety Data Link. 10 million people are on it. The Institute of Medicine studied that Vaccine Safety Data Link and said, you have tens of thousands of unvaccinated individuals that are in this database. You can do a well-powered comparative study looking at vaccinated versus unvaccinated. That study has never been done. That is an absolute shock. At least they tell us it's never been done. Why aren't you comparing the vaccinated to the unvaccinated and asking simple questions? Who has more cancer? Who has more diabetes? Who has more autism? Who has more ADD, ADHD? Who has more lupus? Who has more childhood cancer? These things are all skyrocketing as we watch the vaccine program growing, and you're pointing out a handful of studies that are mostly funded by the pharmaceutical industry that has an agenda to say this isn't a link. So yes, show me a comparative study of the vaccinated versus the unvaccinated that shows that the vaccinated have lower rates of autism, that they have lower rates of cancer, that they have lower rates of diabetes. If you show us that study, then I think we will, we'll have to take a serious look at that and say, then what else is it? What other environmental toxin is it? And then we go into not just the vaccine studies, how do we know it's not vaccines with certain foods?
I want to make sure we have enough time.
Yeah.
I mean, the studies I did mention do look at unvaccinated and vaccinated populations.
No, they don't. No, they really move around. You know what they look at? They look at all the kids that got every vaccine except the MMR vaccine, and then every vaccine plus the MMR vaccine. That's how most of the studies are done. I would call them Jack Daniels studies. I could do a study where you do 10 shots of vodka, and then the other control group gets 10 shots of vodka plus a Jack Daniels, and they say, drive a car, and they say, look, there was just as many car accidents in both groups, therefore Jack Daniels does not cause inebriation. That is how they're doing these studies.
But then how would this new study avoid a conflict of interest?
How do you have a conflict of interest when you run an AI program through a database of 10 million people?
Well, we know AI can be biased at times.
Then you bring in multiple science and say, bring all of your AIs, bring every AI. Let Pfizer bring in AI, let Elon Musk bring in AI, let everyone run AIs, and let's compare those studies and see what we're looking at.
So would that include working with pharmaceutical companies then?
Absolutely. Look, I think that, Robert Kennedy Jr. said it. We're not trying to, have a bias here. Everyone should be at the table. But what we can't have is saying there are products that aren't allowed to be on the table. If it's your product, come on into the room. Let's all sit down and figure out how a proper study would be done. Let's all develop that protocol, and let's stick with that protocol as we look at these issues.
So who would just so I'm understanding correctly, who would conduct it? Private companies working together?
Look, I think that the vaccine safety data link should not be private and hidden inside of the CDC. We, the American people, own that database. It should be made public. One of the things that Robert Kennedy Jr. should do right away, and you know, when we talked about this for years, is just make all the databases public. Let everybody do that study. Let every university that wants to do that study, let them do the comparative study and see what they find. Why are we hiding this? This is, you know, de-anonymized. We don't know who these people are, but we have all this incredible data. Let all the greatest scientists in the world study it. What are you hiding?
That brings me to my next question. Secretary Kennedy made a number of promises to Senator Bill Cassidy of Louisiana in exchange for his vote for his confirmation. And that included, as Cassidy put it, not setting up alternative vaccine safety panels or removing information the CDC does have on its website that says there's no link between vaccines and autism. And as far as Cassidy's concerned, and he said this, science on vaccines is settled. Will Kennedy keep that commitment?
Cassidy changed his stance on the hepatitis B vaccine right in front of the American people. When he was faced with actual evidence and science from Rand Paul, who said, look, you just said the hepatitis B vaccine is a great vaccine. You're asking, you know, Mr. Kennedy to say that he's not going to change anything. And Rand Paul pointed out, this is a sexually transmitted disease that you really only catch if you're sleeping with prostitutes or sharing heroin needles. Why does a day-one-old baby have to get it? They should be able to opt out. The mother should be able to opt out. And Senator Cassidy said, well, we make that point. You're right. If a mother's testing negative, we test every mother in America if they're hepatitis B positive. Cassidy admitted, you shouldn't have to give that vaccine to your baby. That right there was a change in the CDC schedule. If we go with Cassidy's words and stick with what he just said, he just changed the childhood schedule because it's mandated on every child from every mother, whether they're hepatitis B positive or not. So right there, when you watch this dialogue finally happening and real evidence put on the floor, even people like Senator Cassidy will admit, I hadn't thought that through, and I believe he will change his mind, and that's all that's going to happen.
What he actually had said was that not all mothers are tested, or they might be hiding their background.
That's not true. Every mother is tested in America. Every mother is.
He just said that sometimes you might be unfamiliar with their background, or the baby might be born before the mother can be tested.
That I don't know what circumstance that happens in, but I have gotten calls from mothers that are tested, know they're negative, and they said they're calling Child Protective Services on me, Dell, while I'm at the hospital because I don't want that vaccine in my child. They don't need it. And we're calling CPS on mothers we know that are negative. That is insane. And I think Senator Cassidy recognizes that's insane. So when these conversations start happening, you're going to watch a shift because the public is not going to stand for this level of stonewalling and gaslighting when they start seeing the actual facts.
But for the sake of those commitments, which Cassidy outlined on the Senate floor, Kennedy yesterday said he would, nothing's off limits, he would scrutinize the childhood vaccine schedule, but how can he do that but also keep those commitments?
Those commitments are based on all the science that exists. I think when Senator Cassidy sees a real double-blind trial done or watches a vaccinated versus unvaccinated database study that comes out, then you say, hey, you know, we were looking at old science, not very well produced science. We have new science here. I think what he's going to do, and I think Senator Cassidy's right. And by the way, Robert Kennedy Jr. has never said he's going to go in and suddenly just wipe vaccines off the problem. He's been saying from the beginning, I'm not going to do that. He is not anti-vaccine, he's pro-science. Robert Kennedy Jr. is finally going to do the science the way it should have been done, unbiased, bringing everyone to the table. And when that science is done, he's going to show the whole nation. And people like Senator Cassidy are going to have to say, not only do I now see new evidence, the entire nation's seeing it. So now what are we going to do about it? And then you have a very important dialogue that's going to begin. And that's all Robert Kennedy Jr. wants to have happen.
We're running out of time, so I did want to go back to one question that we missed, and this relates to corporate interests. Should the FDA dismantle its user fee program?
I don't know anything about the user fee program.
It's part of how they get funding, and the question, I guess, is if you want to remove corporate interests from agencies like the FDA, should more federal funding be devoted to the agency to make up the difference?
I absolutely do not think that corporations should be funding any of our regulatory agencies in any way, not through any nonprofit structure or anything. There's a lot of different ways that corporate funding goes in there. we pay enough taxes, and I think if we clean house and start limiting just wasteful spending, we should know that the citizens of this nation are funding everything that's happening inside the regulatory agencies so they can trust it. I think Robert Kennedy Jr. wants to end a lot of the kickbacks. We shouldn't have people that are inside of FDA or CDC or NIAID, making money off of products that they developed and then be the same team that are saying, oh, and they're safe. I think that conflict of interest has got to end. So ending revolving doors, ending funding come from the corporate interest, I think is critical. If we're going to get back to, as Dr. Redfield said, getting back to having trust in our regulatory agencies, we have to know that they are not in bed with the corporations they're supposed to be protecting us from.
Mm-hmm. And with that, we'll conclude today's programming. Thank you, Mr. Bigtree, for your time. And thank you all, everyone following along today, everybody who attended. We'll be back very soon with more in the first 100 days of this new administration.